Open book, GIT 2, and the topic here is gastric cancer. Seemingly simple, but very difficult for us to answer. Why? So, the etiopathogenesis. Genesis means always a development. It is not cause. So, here I am finding a series of events. Normal, superficial gastritis, atrophic gastritis, intestinal metaplasia, dysplasia, and cancer. There can be a lot of factors. Here, for example, dietary factors, or there can be an infection. These are all summarized in this one. I would like you people to kindly mug it up because any of this, talc rice, for example, in Japan, there is an increased incidence, and also H. pylori, metaplasia, pernicious anemia, strangely, and blood groups. So many facts are there. Each one can be given as an MCQ. The smoked fish, it contains benzopyrene. Types. When it comes to the types, it can be microscopic types or it can be the gross types that we are seeing. Microscopically, 95% is adenocarcinoma, and these are all the subtypes. Please by heart. The rest are adenosquamous, squamous, rarely small cell carcinoma, and undifferentiated, which means we cannot identify. The Lawrence classification is important, gastric or diffuse. That is what I am seeing in this case over here, the Lionitis plastica or serous carcinoma. Or there can be a fungating lesion that is present in this case. So this is a proliferating lesion. And here the mucosa is normal, but underneath I am able to see the signet ring cells. Grossly, the types can be proliferative, as you are seeing over here. A fungating lesion like a cauliflower. Ulcerative, ulceroproliferative. Infiltrative is what we had seen earlier. So this is infiltrative. The entire stomach is involved like a leather bottle. And this is an ulcerative lesion that we had shown earlier. And this is an endoscope by which I can take a biopsy, take a picture, fed onto a computer, etc. Early gastric cancer, very rare question for you people, but here the mucosa part of it is being involved, and I would like you to kindly by heart only what is given in the dark blue. What are all the lesions that are given? So microscopy, the signet ring cell, for example, nucleus pushed to one side, draw this diagram of the signet ring. And the special stain that is used to identify, I had given in this box, kindly memorize. The spread, it can be a lymphatic spread. So what will happen because of this? A Trozier sign means there is an involvement of the lymph node over here. Trozier sign is something different. It is something like a migratory angiitis or vasculitis. It was diagnosed by the same person. He had the cancer. So the routes of spread can be direct to the adjacent region, horizontal. Please note these things. Kuchenberg's is a distant tumor. And this is a picture of Acanthosis nigricans, which is a paraneoplastic syndrome. Sister Joseph's nodule in the umbilicus. So you can imagine the number of questions that can be asked from this page alone. And if you write it, you are too good. Thank you.